technical issues. So my name is Barry Twomey, and I'm just going to pretty much act as the MC for today's webinar on digital transformation in healthcare around academic and industry partnerships, and I suppose just the collaboration around innovation for digital health and health data analytics. Today, through the agenda, there'll be just a quick introduction from myself, and then I'll introduce each of our four speakers individually, and then there'll be an opportunity then for kind of a Q&A and a discussion session then with Dr. Carla Perrotta at the end. If you have any questions during the webinar, please put them in the Q&A section, and if we can answer them on the spot, we'll answer them. Speakers can answer them, or we'll use them at the end for the Q&A discussion section. In terms of our four speakers today, we've Elizabeth McCarthy with PwC and HealthTech Ireland. Then we've Dr. Cailbhe Doherty, who's an assistant professor in the School of Public Health, Physiotherapy and Sports Science with Carla. And then we've Professor Brian Caulfield, who's working in the Insight Centre for Data Analytics. And then lastly, we've got Susan Treacy from HealthTech Ireland. Sorry, who's the CEO for HealthTech Ireland. I suppose the reason I'm speaking before everybody else is with the Advanced Centre, who are hosting this webinar series. We're working with a number of different schools in UCD, ATU and TU Dublin, and it's a kind of a funded initiative to improve the offering around flexible and part-time learning options for learners. So that's a mix of kind of master's programs, but then also micro-credentials. So you can take your module and you can add them all up. So it's offering courses from level 6 across to level 9, all the way from individual modules through to master's programs. The Advanced Centre is funded under the HCI Pillar 3 by the HEA, and it's one of 24 projects nationally. There's typically 2 entry dates, which is January and September, with some limited options in the summer as well. And I'll come to that in a little bit around some of the modules we're offering. So health data analytics, just what incorrectly tagged there, is one of our 11 themes. And in terms of what the Advanced Centre is trying to do, it's that kind of flexible learning pathway. So you can take your individual module instead of having to sign up for a cert, a diploma, or even a full-time master's. And you can start stacking these then towards awards into the future. And not everyone needs to sit down and do a full master's or even has the time to do it. So if you can go in and take the individual modules that you're looking for, you can kind of upskill in those areas as you need them, with the opportunity to continue on and finish an award by earning the rest of your credits for certificates and diplomas. And the aim here is to try and make this as flexible as possible. So similar with the micro-credentials initiative that's going on nationally, it's to make upskilling as easy as possible for people who are out in the workplace. In terms of the health data analytics team, there's a wide range of courses available from micro-credentials all the way through to master's programs. So there's the 2 websites, either through the advancedcentre.ie or the UCD micro-credentials page also has a number of health data analytics modules. What's probably of interest to a lot of learners, and one of the key issues a lot of learners have, is it's either cost or time. And we can't do much about time, but we can certainly help with cost for the next 2 enrollment cycles. That's September and January. And there's between 50 and 80% subsidies available for a large range of modules in the UCD and ATU offerings for health data analytics. So if you go through to those 2 web pages, you can get some more information. Out of the advanced modules, there's the Introduction to Biostatistics, Patient-Reported Outcomes, Health Economic Analysis, Clinical Trials, and Introduction to Knowledge Synthesis, Systematic Reviews, and Meta-Analysis. So those courses are now either 50 or 80% discounted. So if you have any questions on that or even other courses, please get in touch. There's the details for the Advanced Centre. And look, as the webinar goes on, please put the questions into the Q&A section and we'll either answer them live or catch them then at the end. So I'd just like to invite Elizabeth McCarthy to join us as our first speaker.
Thanks very much, Barry. I'll just share my screen here.
Okay, I'll leave you to it.
Can you see that?
Yep.
So, as Barry mentioned, I'm a director in the Government and Healthcare Advisory Team in PwC, which is a global organisation. So I'm just going to present some insights that we have from international work with our clients, but also how they relate to Ireland as well. And I'm also the chair of the Digital Health Working Group for HealthTech Ireland. So you can hear more about that from Susan shortly. So there are 6 global trends that I'll just touch on very briefly. The first one is around leadership. And it's really about whether or not leaders in the provision of healthcare are actually fully leveraging the appetite that's there among people post-COVID for the use of digital health technologies. PwC carried out a survey of 10,000 people across 10 countries, and 37% of the people who were surveyed said that they'd be willing to use virtual visits for ongoing treatment for a chronic disease, for example. But interestingly, when we look at the results of the surveys of the actual providers of healthcare, the leaders, they were saying only 17% of those felt that virtual visits were an effective way that they were considering for management of patients with chronic disease. So it's just interesting there. There is, now is the time to kind of grasp that ambition that people have. So we need to make sure that leaders actually do that. In terms of workforce, I think everybody knows the demand for digital health skills significantly exceeds supply. So in Ireland, we have like a really strong ecosystem when it comes to digital health, but also if we look at medtech and pharma, there's over 700 countries employing 90,000 people. And SkillNet Ireland carried out a survey of just 46 of those companies. And from the medtech and the pharma ones in particular, it's clear that a really strategic priority for those companies is investment into digital health. So of just those 46 companies, they had plans, or they have plans, over the next 4 years to hire 1,900 people. So there's a huge amount of demand there for these skills, and the 5 top areas that they talked about were data science and AI, product design and user experience, software development, information governance and cybersecurity, and then finally domain knowledge around the area of digital or connected health. So like to meet that demand, a lot of those companies are upskilling current employees, but they're also obviously trying to find out in the market people who have those skills. So it's a good time if you're trying to engage after studies in the area. Next theme is around sustainability and ESG. So there really is an increasing focus on ESG and digital health. It's an important enabler of getting to net zero. We can see that if you look at the benefits of virtual appointments or online booking or electronic medical records. Like they really all contribute to reductions in greenhouse gas emissions. So, but what's really changing now is that when digital health providers are bidding for work to support, when solution providers are bidding for work to support a healthcare provider, they're being asked about their ESG goals and their credentials and what their plans are to adhere to those. So we see the HSE have a target to get to net zero by 2050. So when PwC are responding to tenders, we're being asked very clearly, what are you doing around ESG? And being asked to show how we're actually working towards the goals that we have. So it's something for any organization that's developing a product to be very cognizant of. The next theme is around consumer participation and access. So there's a huge amount of data that's been gathered, for example, from wearables in particular. And what's really becoming clear now is that people are much more open to sharing their data, and they're aware of the benefit that it will bring to them if their data is anonymized, obviously, is being used to help develop solutions. And Cailbhe can talk about that much more knowledgeably than me, so I won't say any more. But just one comment on that is, on the flip side, um, patients are actually now more demanding in terms of access to their own data. So they're happy to share it, but also want to be able to access everything that's related to them. And the HSE are moving towards that through the shared care record and the health app, which is great. AI, I think goes without saying, AI is transforming healthcare, whether it's through digital diagnostics or even in healthcare providers, the operational efficiency of how they run an organization. All of that is massively evolving through the use of AI. And now we have the EU AI Act as well to make sure that that's happening in an appropriate way. And then lastly, the last key trend is around equity. So digital health technologies have huge potential to improve health equity. The World Health Organization reviewed inequalities in access to and in use of digital health technologies. And what they found was consistent evidence of higher use in urban areas compared with rural areas, in individuals of white ethnic origin, in English speakers, in individuals with higher education, with higher economic status, and in younger people. So there's a real opportunity now to close that gap. And it's important that in the development of solutions that there's co-design of all of those relevant stakeholders and populations to make sure that it actually does improve health equity and not drive it in the other direction, which is the last thing that we want. So they're the key. It's like a real whistle-stop tour of some global trends that we're seeing. And what I'll look at now is I just have one other slide, which is to look at the key learnings that we have seen from large-scale digital health implementations. So when you actually go to implement a solution, there are some key things that are critical to the success of the implementation. So the first of this is around governance. So if you don't have robust governance at the start of an engagement, there's so many things in the implementation of a solution that can crop up that you're not aware, like you're not expecting. It's really important to have a framework in place for decision making and keeping things moving forward. The next one is around clinical engagement. So implementation of any solution shouldn't be seen as an IT project. It might be an actual technical solution, but it needs to be seen as a clinical project in our experience. And that's having engagement, as I mentioned, in the code design with clinical end users, but also at the very start when you're, or at the very, very start when you're trying to design a program of work, and having that buy-in from the very beginning is important. The next one is around data governance. So a robust data governance framework is essential. We all know if you're trying to start using something and you see a piece of data there that you know is wrong, like you lose the user straight away at the start. So having a really strong data governance framework there to manage and address data quality issues is key. And the next one is end user involvement. So I've already alluded to this, but not just in the co-design, but in the actual steering group, for example, in the decision making, and then identifying clinical champions that can be a conduit between the team that's actually implementing a solution and the wider group of end users is really helpful. And then lastly, change and adoption. So investment in change and adoption at the very, very start of any program of work to make sure that there is a cultural readiness there to embrace the change that's coming is absolutely key. If you don't do that at the start, you can have the best product in the world, but if people haven't been brought on that journey, then often it's not going to be as successful as it could be. So again, that's another whistle-stop tour of just some learnings that we have gained from working on these large-scale implementations. So that's all I have. Thank you very much, and I'll hand back to Barry.
Great, thanks very much, Elizabeth. It's all very interesting, and I suppose the next speaker should be a nice follow-on from the work you've just outlined there. So I'll just bring in Cailbhe Doherty.
Hello, everyone. So in this talk, I'm going to advocate for a fairly simple idea that wearable devices are going to play a bigger and bigger role in all aspects of our lives, particularly in healthcare. Um, but there are a couple of barriers or obstacles in the way of us realizing this, and there's also a few risks if we realize the vision a little bit too well. Now, what I'm presenting here is kind of a condensed version of some of the discussions that we would have in some of the modules here in the School of Public Health, Physiotherapy and Sports Science. You see, over the last 5 years or so, there has been a massive increase in the number of people owning and using wearable devices. In the US, in the US, 40% of people own some kind of wearable device. Yeah. And then in Germany, the figure is it's a little bit higher in Europe. And in Germany, the figure is 42%. In Sweden, it's 45%. In the UK, it's 53%. And then in Ireland, it's actually closer to 60%. The wearables are now being adopted as quickly as mobile phones were in the late 2000s. And in 15 years' time, they may be just as commonplace as smartphones. Now, think about what that means in terms of the scale of data collection that is going on every single day. We are rewarded with floods of biometric information with minimal effort, or at least individual users are. Just strap on a ring or a smartwatch or a wristband. You can track your sleep, your exercise habits, your stress, your blood oxygen saturation, your blood pressure, your body composition, your respiratory rate, and more. That's not even a comprehensive list. But to what end? What's the benefit? Well, for us, this is where it starts to get a bit controversial. Advocates of the quantified self movement will cite anecdotes about their sleep apnea or their allergies or their migraines, which up until that point had resisted the cures of mainstream medicine that they yielded to their pattern finding prowess with the aid of their fitness tracker. But obviously, all of this information, all of these articles, it's just anecdotal evidence. Is there any well-designed research in this area? Well, if you'd asked me that question 5 years ago, I would have said not much. But recently, there have been some really nice population-based studies leveraging wearables, for example, facilitate real-time surveillance of flu-like illnesses. This study from a team at Scripps used de-identified data from a cohort of 200,000 Fitbit users. So the users wore their Fitbits consistently between March 2016 and 2018. You can see this in the figure on screen, which shows the number of users who met the study's threshold to be included in the analysis. And the researchers found that the proportion of people with abnormal results in heart rate, sleep, and physical activity, all measured from wearables, aligned neatly with the prevalence of flu-like symptoms as measured by the CDC surveillance systems. If you think about what this means, because the model built using wearable data so closely matched the ground truth, the kind of health reports produced by the CDC, this was one of the first examples of how wearables might be able to help us know about flu-like outbreaks earlier than that traditional method. This could be really important for responding quickly to health threats or pandemics. Now, all of this research took place before the coronavirus pandemic. We just didn't have the resources or the uptake of wearables to implement that wearable informed rapid response at the time, if only. Because if the research being produced out of the Robert Koch Institute in Germany is anything to go by, data from wearables will be hugely valuable if a similar pandemic was to strike again in the future. With COVID-19, data from wearables showed that an uptick in resting heart rate alone happened 4 days before anyone felt any symptoms. So by one estimate, 63% of COVID cases could have been detected from changes in resting heart rate before the onset of symptoms. So we're not talking about a massive catalog of research here. Specific groups are leading the way right now, but there does seem to be signs that wearable technologies and this whole concept of self-quantification can have a positive impact on society. The question the community is still grappling with, though, is whether wearable devices can actually measure what they say they are measuring. So we recently looked into this as part of an umbrella review, which is a systematic review of systematic reviews, basically looking at all the research into consumer wearables and whether they can accurately measure things like heart rate, aerobic capacity, energy expenditure, sleep, and step counts. Now, this is a massive body of research. It's over 400 papers, so I don't have the time to go into the details, but overall, I'd have to say the news is pretty good, albeit for certain or specific metrics. So accepting a little bit of error, wearables can measure things like heart rate, particularly at low and moderate intensities of exercise, heart rate variability, your aerobic capacity, your blood oxygen saturation, and the number of steps you take every day in specific context. And they're not so good at measuring the number of calories you're burning, nor are they great at measuring your sleep. But the commercial ecosystem continues to release new and arguably better, more accurate devices every year, and several software updates in a single year. So things are improving. The challenge that comes for those of us in the research community is that every time there's a new device or a new proprietary algorithm, which happens every couple of months, all that old validity data we've gathered essentially goes out of date, and we have to do it again. And that's why it's so important that we have the expertise to kind of do this research. And then because the academic engine is so slow, keeping up with every new hardware and software release while going through that gauntlet of peer-reviewed publishing is pretty much impossible. So in short, we need a new approach to validation, because if we don't know what can be measured or what is worth measuring, the ultimate endpoint of this whole wearable movement will not be achieved. So there'll never be that healthcare panacea that they're being touted as. Now, my viewpoint is obviously cast by the Irish context, but we're not alone as a nation when it comes to some of the challenges that we'll face in the near future. We have an aging population, an overburdened healthcare system, increasing sedentariness. Many see wearables as a kind of a key component of the solution to those problems, a way to remotely monitor population health and the health of our patients so they're not occupying hospital beds, or a way to initiate national public health initiatives to, say, increase physical activity, or a way to limit the spread of disease or predict outbreaks. Now, the first step in this direction, from my point of view, is a way to collate and centralize all the different wearable data streams. Because right now, whether you own a Garmin or a Fitbit or an Apple Watch or an Oura Ring will determine which manufacturer's app ecosystem you are tethered to. So you've no way to migrate your data to another ecosystem if you decide to change your device, and you've no way to share your data with your healthcare provider other than a really rudimentary export. And this is certainly the case in Ireland. You also can't really take your data out of that ecosystem to look at your own health trends over the years and take ownership of your data. And this is going to be increasingly important in this age of AI. So if you think about it like this, if you continue to use the device you're wearing now for the next 10, 20, or 30 years, what insights could you glean from your health data? What could your healthcare professional uncover about something that might save your life, be it a gradually deteriorating aerobic capacity or increasing blood pressure or a new cardiac arrhythmia? And then what might we uncover at a population level, at a public health level? So that's the premise of the work that my research group is currently undertaking here in UCD, to build a free data bank and data donation platform for wearable devices, one that researchers can leverage to garner population level insights into, for example, when and why people stop, or for that matter, restart participating in regular physical activity, or to facilitate clinical trials with wearable devices. We also see this as a way for end users to untether themselves from a given manufacturer, but I tend to focus in on the research and sort of pedagogical or teaching aspect of this platform. Because in my view, wearable devices are going to get more and more accurate. They will be better and more capable in measuring up the aspect of our health. Now, this might be used as a force for good. It might be used, for example, to identify those who, because of their behaviors or biometric profiles now, are at an increased risk of cardiovascular, metabolic, or neurological disease 10, 20, or 30 years down the line. And that's what we need to prepare for as a nation. Now, this could be leveraged to increase your insurance premiums, or it could be used to deny you insurance altogether. Or maybe it'll be the trigger of a long-term program of prophylaxis, where you're contacted by your healthcare provider and empowered to make the necessary lifestyle changes to decrease that risk. So I'll close by saying we're at an inflection point, and it'll be important for us to have this kind of dialogue and to consider this. Because whatever reality comes to pass, it should be one that we choose rather than it being one that's forced upon us by some multinational company. And if this is a discussion you'd like to take offline, feel free to reach out. My contact details are on screen. Thank you.
All right, thanks very much, Cailbhe. I suppose the natural follow-on from this is another further deep dive into the data side of things. So I'd like to introduce Brian Caulfield.
Thank you very much, Barry. And never too easy to go after Cailbhe's beautiful audiovisual experience. So back to basics here with me. So yeah, I'm Brian Caulfield. I work alongside Cailbhe and Carla in the School of Public Health, Physiotherapy and Sports Science. I'm also a PI in the Insight Centre in UCD. And Insight, just to give a little bit of background, Insight is Ireland's national data analytics research centre. We've been in existence since 2013. We are a cross-institutional centre. We're in almost every academic institution in the country at this stage. And we have a core funding provided to us. We're on our second cycle of a 6-year funding grant from Science Foundation Ireland. And we use the core funding we receive from SFI to leverage a lot of additional investment from industry collaborations and working at a European and an international level. And, you know, because we're across the whole country, we're very much a collaborative centre. We work a lot with industry, but we also work across the institutions. At any one time, we have between 400 and 500 people involved in the Insight Centre, between the academic PIs, the postdocs, the PhD students, the research assistant, and the administrative staff. To date, we've had over 200 collaborations with different members of industry, and we have graduated over 1,000 people at this stage. So it's a centre of significant scale. From my perspective, I come from a physiotherapy background. I'm interested in how people move, and my research is associated with, very similar to what Cailbhe has just spoken about. In fact, Cailbhe and myself worked together very closely for a number of years. I'm interested in leveraging data from wearables to either better understand human performance and behavior in health and sport, or to enhance it. And, you know, coming into a centre like Insight gives me a great capability of doing that. In Insight and in other venues as well, I've had the opportunity to collaborate with a lot of different companies, you know, from the large multinationals like Intel, Fujitsu, Huawei and Novartis, through to the smaller companies like Biomedical Research, or an SME in the medical devices sector, or Salumedia, a digital health company from Spain, and some startups out of UCD, like Kinesis Health Technologies and Output Sports, through to new collaborations we have at the moment with companies like Enpro, who are a startup from Galway, who are making headgear primarily for rugby players. And in these collaborations, I think I'll speak a little bit more about these collaborations and the impact of these collaborations in a short while. But if we think about this challenge of digital transformation in healthcare, I think, you know, we've had many false dawns in healthcare, and we've had many new waves of technology. We're currently in the, what you might say, in the kind of the wave where we're hearing an awful lot of hype around what generative AI may be able to do for healthcare. And in my news feeds that I'm reading, every single day I see 3 or 4 new opinion pieces about the promise of AI for healthcare. And before that, it was, you know, it was big data at one stage. At one stage, it was wearables. And despite all of these technological advances, we're still making only incremental progress. We have had a much more rapid rate of progress in terms of the different technology platforms and the different technology opportunities that are available to us in health management, and much slower rate of progress in how health management is changing on the ground and how digital transformation is making a positive change in healthcare. And there are many reasons for this, you know, why digital transformation hasn't just grabbed hold in healthcare the way it has in other industry sectors. But put simply, it's really complex and it's really difficult. And I think I've worked with an awful lot of companies, particularly from the health or from the tech sector, who have all come along and have tried to transform healthcare and have made an assumption in the beginning that it would be something that was relatively easy to do, and have gone away with their tail between their legs, or have changed strategy after spending a couple of $100 million and then finally make some progress. And if we are to deliver a future health model where we put the person or the patient at the center of the process, and we organize the delivery of care and the management of health throughout the lifespan around them to deliver what I call a connected health model, where all of the stakeholders in the process are, connected through timely delivery of accurate and pertinent information that helps them make the right decisions in the right place at the right time. We have an awful lot of work to do, and we are never going to make progress. I think the issues that were outlined in the first talk are very, very, really strike a resonant tone with me, as they're very much in line with my thinking as well. And we're never going to make progress unless we have a very wide platform of interdisciplinary collaboration and intersectoral collaboration. And in terms of intersectoral, we have to have people from the academic sector, from the business or industry sector, from the clinical sector, and from policy, all working together to make any level of progress. And in terms of disciplines, it's right across the spectrum. That's one thing that I've really seen in my work in this area, in that, there's technical, clinical, social science, all sorts of different research expertise need to come together to deliver advances. And maybe just focus a little bit on, just in terms of intersectoral, just the academic and industry collaboration, and maybe some reflections on my own experiences of it. And when Carla asked me to talk about this, I thought, well, maybe I'll talk about why I collaborate with industry, and make it a bit more personal. I think there's many, many reasons why people from the academic sector would collaborate with industry. And I think, some of the things that I've experienced is that working with industry as an academic gives you a real window into real world challenges and the industry trends or needs. It gives you access to expertise that's right at the coalface. People are trying to solve problems that have a short-term journey to make a meaningful impact. A lot of times in academia, our work is a couple of steps removed from the coalface. So this gives us, a route right into the coalface. It gives us, in many cases, access to research infrastructure that we couldn't afford in the university, capability or data sets. Through an industry collaboration last Friday afternoon, we have just received access to a really significant data set from a study that one of our industry partners had invested a very large amount of money in, a data set that would take us many, many years to collect. And now through this collaboration, we're able to access such data. There's opportunities to license some of the outputs of our research to industry. There's also a really good opportunity to generate learning experiences and career development opportunities, as well as putting early stage researchers in the shop window for career opportunities. Obviously, working with industry also gives us a lot of access to funding and an opportunity to deliver real impact. And just on that, if I look back over the last 15 years of my work in UCD, the research work that has delivered the most impact in the real world setting is that research that has involved collaboration with industry partners. We worked with biomedical research on a product that is now being marketed by a different company, Atlantic Therapeutics, called Innovo, that delivered a surface electrode electrical muscle stimulation solution for stress urinary incontinence. And that has reached literally millions of patients, and it's out there in the marketplace. And we never would have been able to achieve that without industry collaboration. And that was through an Enterprise Ireland funded innovation partnership. I'm also currently involved in a large public-private partnership initiative called Mobilize D, which incorporates a €50 million investment from a very large range of industry partners in the pharma and clinical research organization sector. And that project has single-handedly moved the field of wearable-enabled gait analysis in the real-world setting forwards by a number of years. Prior to that, that field was characterized by a very large number of very similar yet different enough that you couldn't pull data from them studies that were all happening all across the world, thousands of studies with relatively small numbers of participants. But with this large public-private partnership, we've been able to consolidate everything and carry out a study over the last 5 years of significant scale across 10 European countries. Why industry should collaborate with academia? It gives access to a range of expertise across disciplines and institutions. And through centres like Insight, Insight is one of a number of national research centres of its kind. And when you collaborate with centres like this, you get an opportunity not just to access different disciplines within a single institution, but equally to reach into multi-institutional collaborations to get a greater bang for your buck. And the types of things we can do are endless. Collaborating with academia also gives industry early access to talent, opportunities to engage in pre-competitive collaboration with other companies, opportunities to influence our educational programs, such as Advance, access to state supports and tax incentives, as well as a range of other things. And thankfully, in Ireland and beyond Ireland, there are literally hundreds and hundreds of different funding instruments to enable the collaboration between academia and industry. I'm not going to go into not even one of them here now, but we are happy to talk to companies about a range of different funding instruments, and their staff in the universities are extremely good at leveraging funding to enable those types of collaborations between academia and industry. And then finally, before I finish, I just want to mention that there's maybe a couple of misconceptions around the interface between academia and industry. One is that managing IP in academic industry collaborations is difficult. And that's absolutely not the case in Ireland. I think Knowledge Transfer Ireland has done a fantastic job of creating a national IP management framework. So there's a very clear pathway for managing the IP assets that arise from collaborations. Progress, I hear people sometimes saying that progress is too slow if you align your research needs to academic cycles. Again, that is something that can be true if it's not properly managed, but a lot of our academic industry collaborations don't, for example, tie themselves to PhD students' timelines. We would work with postdoc researchers, etc., working on projects where we can turn things around an awful lot faster. Academics are not connected to real-world realities. That can be true. There's many of us do live in our ivory towers, but I think those of us who are working with industry get a really good understanding of the needs on the ground, and frequently we can connect. We often find that when we work with large multinational partners, we can often connect the dots within those large organizations where an awful lot of times thought processes are siloed. And on the other hand, there's an incorrect assumption that real discovery only happens in universities, and that's absolutely not the case. I mean, we work with people in the labs functions of large companies who are academic researchers. The only difference between us and them is that they don't have a teaching load in the university, and they are spending their time doing really interesting, innovative, discovery-based research, but are doing it in industry. So it's a really good ground for collaboration. So thank you very much for your time.
That's great. Thanks very much, Brian. I suppose, look, I'd like to introduce our final speaker now. So Susan Treacy, I suppose, again, a nice follow on then to go into a little bit more detail on the collaboration side of things. So Susan, we'll hand it off.
Thank you. Sorry, I'm having Zoom problems. I've had Zoom problems all morning. I've clicked something and the screen has gone completely for me. Can you hear me?
Yeah, the presentation's up there as well.
I just can't see anything. Sorry now. You can see the presentation, yeah?
Yep.
Apologies.
It's not moving on to the next slide though.
Here I
Susan.
am here. Yeah. Is that working there? No.
Okay, well, we've got a workaround in place, so I'm going to share Susan's presentation, and just give me a second there.
Great. Thanks, Barry. Am I good to go?
Yep.
Okay, great. Thank you. Thanks, everybody. I just want to continue on, I suppose, in the same vein as Brian. It's great to hear what can be leveraged in collaboration between academia and the importance of the collaboration between academia and industry. So I'm going to briefly talk about HealthTech Ireland. I'm going to shoot through a load of slides, and then I will move on then just to some of the collaboration that HealthTech Ireland is doing across the sector. So if you want to go on there, Barry. So who are HealthTech Ireland? We're the trade association. We're not for profit, and we're the trade association for startups and SMEs and global companies. And we span medical devices, surgical devices, digital health, and mental health. You can click on there, Barry. Thanks. This is just a snapshot of our membership. So we have everything from manufacturers, but also then we have professional associates, like Liz would be chair of our digital health working group, so PwC would be involved as well. Internationally, we are a member of MedTech Europe, so we sit in Brussels on the National Association Council, and we feed information back and forth from the EU Commission. And then I would also sit on the Global MedTech Alliance, and we'd feed information in and out of the World Health Organization with our colleagues across the world from the equivalent trade associations. Thank you. We just finished our new strategy, and it was launched in May at our symposium. And I suppose first and foremost, we were founded 42 years ago by a group of distributors in Ireland, and first and foremost, we represent the members. They contribute a fee to have the organisation run. But very quickly, I suppose, our focus is around understanding, collaboration, meaningful engagement with the Irish healthcare system, around enhancing and moving the dial for patients in Ireland. Thank you. And how do we do this? So we have a number of working groups. We have groups on procurement, regulatory affairs, digital health, and then we have a group, HealthTech Connect, where we work at a C-suite level. So that would be global directors, country managers, working with HSE directors, CEOs, CIOs, COOs of the hospitals, and helping them to tackle these different areas. The chairs and vice chairs of these working groups as well would have a lot of expertise. So they'd be all of our different members. But for example, the chair of our sustainability group was the chair of Friends of the Earth. So it means that people who are involved and working in the groups and working across the sector as well have that knowledge and that passion. And then when the healthcare system comes to us, whether it's a hospital or a clinic or a GP or a clinician, and they want some information on some of these areas, we can direct them into regulatory affairs or procurement or whatever the area might be. Thank you. These are just some of the groups, and we work really regularly with a lot of these groups. So IPOSI's the patient organisation, HICWA on HTA, Smarty 8 is a consortium in Dublin 8 with the local county council, the digital hub there, St James's Hospital with Mary Day. So all of these groups, we work on different initiatives and different challenges. Thanks, Barry. We are about collaboration and engagement. So we run 2 events as well, 2 cross-sector events where we invite in our public sector colleagues, and we'll talk about those different topics. So we have the National HealthTech Innovation Awards, we run that, and the different working groups. And often you'll have Microsoft and AWS are on our digital team, Medtronic and Boston are on our team. So you'll have competitors all the way across the organization, but they all come together to work together on the common challenges in healthcare. Barry. So I suppose what does this mean in practice, and how do we leverage all of this information and the knowledge base that we have in our membership? So I'll just go through a few of the different initiatives that we've been working on. So in sustainability, I noticed, I suppose, about a year and a half ago, obviously tenders were having more percentages to achieve sustainability targets coming into the tenders. But often there was very little communication beforehand. So when the percentages came in, smaller SMEs or mid-size SMEs weren't fully ready for it. And as a result, they couldn't go for those tenders, or they wouldn't be involved. And often it meant for patients, maybe the best option wasn't available for them. So MedTech Europe was coming into Dublin last year. They picked us to have their conference, and we decided to do this cross-sector collaborative paper. So this brought together government departments, the HSE, Enterprise Ireland, HealthTech Ireland, and we put down all of the information, and we worked on this particular issue, procurement and supply chain, where we could have the most impact, I suppose, on sustainability targets. As well as that, we were invited then from that in to sit on the National Sustainability Strategy Working Group with the HSE. So it meant that industry were a part of that, and the insights could be brought into that, so that when the strategy came out, everybody's on the one page. So the good thing about this now is the one of the 6 recommendations, the first of the 6 recommendations, we just launched this year in May, a year later, the first public-private partnership for a Centre of Excellence for academic alignment. So that's government funded through SkillsNet. And this will mean that the companies know what the HSE will need. We're much more aligned, and then we can increase the percentages without any risk to supply chain or to patient products. You can click on there, Barry. These are just some of the people and the organisations that were involved in that. And it was great to showcase this to Europe. And actually that paper now has gone in to MedTech Europe, and they're looking at that at a European level as well. Thank you. Around regulation, so we have some really significant changes coming for medical devices, for digital companies. We have health technology assessment, the medical device regulation, the AI Act is coming in, it's approved, it's coming in. And so for us, we meet with the HPRA quarterly. We talk about what this means for companies, what this means for the healthcare system, and how to ensure, again, product supply, we keep that flow and no unintended consequences. We run breakfast briefings as well, and we'd have organisations like PwC speaking about the AI Act, EIT Health and the European Health Data Space. And importantly then, when there's something that's really affecting healthcare systems across Europe, we'll come together on that piece. So a particular initiative on that with MedTech Europe was a co-signed letter to the EU Commissioner just to flag that there could be a risk in terms of supply chain. And so we worked through all of those details and information. So we'll sit on the working groups, the equivalent working groups in MedTech Europe on sustainability, value-based healthcare, digital health, so that everything is aligned to ensure that there's value brought across the ecosystem for everybody. Thanks, Barry. I suppose we're here to talk about digital health. So with the digital health strategy, so the government just released the framework, but a year ago we would have worked on the digital health strategy, the framework, the implementation plan with the HSE around adoption and acceleration. So now that we have that framework and we have the implementation plan, how do we accelerate adoption, to get tech into the hands of people and into the hands of the clinicians and users. And then we have information around procurement and knowledge, because often the procuring of the digital solutions will be a barrier to adoption, and then upskilling and best practice. Thanks, Barry. So just on that, how we did this with the digital health strategy, we had two workshops with over 50 companies in digital health. We took all the key takeaways, condensed it into 15 key insights, and then delivered that back into the Department of Health and into the CIO and the CTTO, John and Fran. And they took those and built it into the framework and considered it so that it would make the framework as well a little bit more robust in terms of the industry insights. We have signposting around strategy and innovation office that was there, and some knowledge and sharing sessions as well. Thanks, Barry. So what we're trying to do as well is work with the HSE on accelerating adoption. And we had a workshop recently in the Mansion House, and it was the first of its kind, a public-private workshop to identify what are the barriers, what are the enablers, what can we bring in terms of the HSE and industry to accelerate adoption. That was really good, and we're going to have a paper coming out of that, take away the key outputs and try to find the mechanisms. For example, there's a framework in Norway, Connect framework, that's worked really well there, and potentially that could be a catalyst to enable the public and private sector to work better together to leverage what we have. And then around insights and learnings, so with our digital working group, we have the CIOs of the hospital. So in 2 weeks' time, we'll have one of the CIOs come in. He's going to share the strategy that they have for one of the large hospitals, the challenges that they have, and what they should look out for, and how they could enhance the strategy to deliver faster and to bring digital health transformation into that hospital more effectively. Thank you. That's just a note there. That was the public-private workshop. Thanks, Barry. Then in procurement is really key because our procurement is set up to be quite restrictive procurement. So we're trying to procure for innovation, but then we have some of the procurement tendering can come out a little bit more kind of tendering for, say, for example, a particular medical device, or even something like the curtains in the wards. So we're working with the HSE procurement team and the legal teams to look at different innovation pathways. And for example, the new consultants contract has a portion of funding for digital adoption, and we're working with Spark, HSE Spark. So they're going to give a breakfast briefing to our members as to how to help them to access that funding with clinicians, so we can bring them together, because as I think somebody said it earlier, it is all about the clinical teams. It will be the clinical teams that will drive through as well that adoption, because they're on the front line with the patients. So we want to work alongside the clinicians, bringing in the funding through Spark. We did a particularly good initiative in learning. Philip Lee solicitors advise the procurement teams on these funding pathways and how best to do that, and then they give the same training across to our members, so that again we're all aligned. And then on information, again, breakfast briefings from HICWA, from EIT Health, and then on topics like cybersecurity. Thanks, Barry. Upskilling and best practice. To us, there's three legs of the stool, I suppose. There's the public sector, the private sector, and academia supporting the patients. And academia and industry having those collaborative roadmaps and meaningful engagement that's going to deliver for patients is really critical. That's why we're here today. So I think Brian explained it really well earlier, so I won't linger on that. But I think, you know, unless we're doing this with good governance as well around it, and looking at that impact and outputs, we can really enhance what we're doing across the sector. And then the innovation awards, we run these, and it really highlights what's good, what's working. It gives the sector an opportunity. And when I say the sector, I mean public, private, and academia, an opportunity to see what's working in different pockets of the country, and then maybe adopt that quicker in other areas. Thanks, Barry. So the why, we now have 2 unprecedented public-private partnerships going on at the moment. One around sustainability, one around the trying to, I suppose, build on what's already there, and then have a framework or a roadmap to move forward together to accelerate digital adoption, because we know that the challenges are not going away, and we have to try to solve these problems. They talk about a VUCA environment a lot in digital health, and I suppose what we're trying to do is move that VUCA situation from volatility to vision and uncertainty to understanding, and we're not going to do that without working together. The innovation is great, the tech is great, but it really does all come down to people, to leadership, to culture, and unless we're all working together meaningfully and leading the way in our different areas of the sector, we're never going to deliver this huge transformation that's really needed. And ultimately, sorry, Barry, to go on there, and I go on again. Ultimately, it's going to come down to people. HealthTech Ireland is a members association. We're a very small team, and this is all of our members doing this, but working with collaborative partners and strategic partners. So thank you for that. Apologies about the presentation. Thank you.
That's great. Thanks very much, Susan. And I'll invite Carla Perrotta here, who's probably kind of the reason we're all sitting here together. I will invite the speakers back if you want to join with the camera. And Carla will just wrap it up with maybe a quick discussion and question. Thanks.
Yeah. So thanks, everybody. Thanks, Liz, Susan, Brian, and Cailbhe for being here today. Great presentations, and there was a couple of questions there that were answered already. Just to wrap up, just to summarize, we know the why. Brian gave us a few hints of how through all those funding that is available. Can I ask you, what are the skills that our graduates need to acquire just to be up to speed with the digital health and digital transformation? Just if you can summarize, should we keep teaching the basics, or what is that we have in for their future? Susan?
Yeah, I think one of the challenges, I imagine for students, and I think for organizations as well, is there's a lot of noise as well. And how do you know one thing from the other? I think there's some great trade associations, as in there's ourselves in Ireland, but also the European MedTech Europe. MedTech Europe is great. It's really got its finger on the pulse, what's going on in Europe and in all the other countries. The ABHI is our equivalent in the UK as well. So I think that's important, getting the information from the right source, which I know we talk about all the time. Not to supposed to stay positive with it all. Yes, there's a bit of a trudge, but I think the pace of digital health transformation in Ireland is going to really pick up. There's a really good there's a free Pulse IT, it's called. There's a free magazine resource that's just launched in Ireland in May, and we have it for our members, but maybe it might be something we could have a look at to see for students. But they're doing all the interviewing across the Irish ecosystem to keep the information up to date as well. So there are different resources outside. I'm sure there's resources in everybody's area, but I think definitely LinkedIn. Every student to have their LinkedIn.
Yeah, no, but from our perspective, from the academia, how can we, Cailbhe, Brian, what are your thoughts on that?
What do you mean, Carla? Like, how do we prepare the students?
Yes.
I think some of the interdisciplinary modules that have been kind of developed within UCD over the last number of years, and interdisciplinary within the healthcare area, have been really, really positive. But I think we really should be considering interdisciplinary on a wider scale, and having students, particularly as they get to I always think that there's great opportunities if we can align timetabling challenges for, capstone projects in the various programs that the university offers across, data science, biomedical engineering, social science, and health and allied health should be integrated, so that those capstone projects could, for example, involve design challenges and some deployment element as well. And that gets really early exposure of people who are coming from different backgrounds to understand some of the pain points of the other folk.
Yes, just to have them sitting in the table early on in their careers and know when they jump into the job market.
Yeah, it's only when we kind of communicate more across sectors and disciplines that we really, I don't think we'll ever, nobody from one discipline will ever truly understand the other or become an expert in the other, but at least you can kind of learn the language to a certain extent.
Yes. Liz, will you agree with that?
Sorry, just unmuting myself. Yeah, absolutely, 100%. One area though, just be very to pinpoint on a particular topic. I'm not sure, I don't think the question was this specific, but it just keeps coming up over and over and over again in conversations we're having with the HSE and with private healthcare providers about work that they have planned. If you wanted to pick an area to upskill in, interoperability seems to be something that just comes up in every conversation. So that's something I would find a way. I don't know, in UCD, I'm sure there's plenty of opportunities there to learn about it, or online other courses. But yeah, there's lots of focus on that in all the conversations that I seem to end up in.
Yeah, very good. Cailbhe, do you have any comments on that?
Not a huge amount to add from what the others have said. I struggle to predict where the puck is going to be in 5 years, just in light of AI, and that's sort of the moving space that is the required skill set of a graduating student. But I would say that being at the coalface and having direct contact with healthcare systems and the systems that they use is a strength of our programs. And I think that that sort of tailored, very specific knowledge and also the soft skills that students would develop in these types of programs are going to be more and more important than just than generalist knowledge. I'm not sure how helpful that is.
No,
but,
yeah, transversal skills. Yeah, absolutely. Yeah, Susan, just final, because we have to conclude.
No, a bit like Liz as well, interoperability, but also I hear from clinicians all the time that their training is so specific to clinical training. I'm a biomedical scientist myself, and often it's so directly related to the profession. And what's being required more out by companies and out in the field is conversations, back to what Brian was saying as well, interdisciplinary and but also across the sector, and being able to have those conversations. Leadership, there's a different type of leadership required now. For the traditional management skills actually in some cases go against what's needed for innovation leadership. So I think down the line they'll be the skills that will be needed. So just, I suppose, that'll be my comments on that.
Okay, excellent. So thank you, everybody. Thanks again, Susan, Cailbhe, Brian, and Liz for those fantastic presentations. And thanks for the attendees for your time. And if you have any questions, you can reach out to us. And I believe, Joanna, that the webinar is recorded and that you will forward the link to all attendees. If you're there, yes, I think that's the case. Okay, yep. Thank you very much.
Thank you.
Enjoy the rest of the day.
Thank you.
Thanks.